I was born with a neuromuscular condition called Charcot-Marie-Tooth disease, which is actually hereditary. So there's a range of different types and it affects people in very different ways. So I inherited it from my dad, and then both my sons have inherited it from me. So I've been affected by the condition from the time I could walk, which has progressed. So it's a progressive condition. At 21, Dad rang me and said that he'd been diagnosed with this condition and asked if he had any children. So then I went through all the genetic testing to find out. It was a huge relief to get a diagnosis, but then it was also all of the uncertainty of what happens if my children inherit it, what's the long-term prognosis, what will happen in 5 years' time, 10 years' time. All of these massive questions come with the relief of knowing what it is, but then how is it going to affect me long-term? I think generally the way that doctors are trained in these conditions, there's just not enough time spent during training. I will say that Dad and I used to be involved at the doctor's examinations. So a trainee doctor will come in and assess you with no prior knowledge, and then they have to come up with a diagnosis. Now, when Dad first started doing it, they were getting it wrong all the time. And I know sort of a lot of people who are doing the clinical examinations now, and they're saying that doctors are getting it much quicker. I use a wheelchair now at 38 over distance and when I'm standing on my feet for a long period of time. And it was one of the biggest decisions I had to make. All of the stigma and all of the negative emotions attached to that. And there was no support really. Thank God for my neuromuscular care nurse that she could support me during that time, because it was harder than being diagnosed, making that decision, because it's such a clinical thing. You need a wheelchair, we'll give you a wheelchair, right, get on with your life. The mental battering that I had as a result of no longer being able to walk all the time was huge. The transition into the wheelchair has been difficult, and the way that society sees you differently. So when you think, I'm in charge of a company and I make really hardcore decisions all day long, and as soon as I get in the wheelchair, the stigma and fear of disability, and particularly of visible disability, was dealing with the way people then viewed me. It does take a massive toll on your mental well-being. I found one of the most challenging places to be disabled is within the NHS. They know how to do sick people and they know how to look after people with mental health issues. But I've seen me go into clinic and literally just healthcare professionals flinging boxes in all different directions, panicking because I'm trying to come down the corridor in my chair. Whereas if I'd walked down with perhaps a cane or just with my splints on, they'd have treated me a bit more like a normal person. Never be afraid to ask that person in the wheelchair what they need or if they need something, rather than just assume or react in a really extreme way. One of the things about the condition, the way that the system leads you, is that you get a diagnosis and you end up on the waiting list to see a neurologist. They then do all the neurological tests and then they say, right, what can we do in terms of intervention? And there's very little. The other option is that you're on the lists of the orthopaedic surgeons, because surgery is a way of perhaps dealing with the deterioration and things. But then there's nothing else. There are services out there, but it's kind of knowing how to access them, knowing when you need them, understanding self-management so that you can then say, I think I need to see a physio, I need to see orthotics or occupational therapy. So what we did was we built a clinic where there were a number of different disciplines present. So it was a neuromuscular care nurse, a physio that specialised in neuromuscular, and then orthotics. And my role at the time was that I used to look after the well-being of patients with CMT in Wales. You had an hour with them, and the approach was, if you could fix one thing during this visit, what's the priority? And then what are the other niggles? So people were quite taken aback when we started the clinic, because most people don't know what they want to change and what they need, and it took people time to consider it. We built this multidisciplinary clinic and I was one of the first guinea pigs of the clinic. At the time, I was falling up to 8 times a day, having really bad trouble with managing my condition. I had no independence whatsoever, couldn't go anywhere unless my husband was with me. I went to the clinic and I said, I need to have my independence back through being able to walk by myself, not fearing with these 8 falls a day. I saw the physio who kind of talked about perhaps building up my core stability, looking at how I was walking and how I could perhaps improve myself. And then the orthotist said, I think we need to look at some kind of bracing. And he just brought out a pair of dynamic AFOs, which are very light, fits inside your shoes. And as soon as he put them on me, my whole walking completely changed. I could walk without any aids. I could walk fully independent. So a £500 pair of AFOs stopped me from having to constantly access emergency medicine. The clinic was all done completely unfunded. So every single clinician that attended did so voluntarily. But it was really changing people's lives because they were getting the intervention they needed, which, the specialist can't really do. They can refer you on, but it's all done in isolation. And anyone who goes to the clinic, raves about the support that they get, because it's about supporting and managing that day-to-day living with a condition that has no treatment. It's just a shame that it's not funded, given how much it's supporting people and keeping them out of the biggest, costlier things like surgery. We can only improve now with more research, more funding going into clinical trials. So I think in the next 10 years, I'm sure we'll see improvements, but it's quite frustrating when you're living it.